Has seen a decline in coronavirus cases, but doctors warn we still have a long way to go.
UW Health's Dr. Jeff Pothof joins us now for our weekly update. Welcome back to the show.
Welcome, doctor.
Good afternoon.
So what can you tell us how we stand this week compared to when we spoke last week?
You know, numbers still look pretty good, where you continue to see a slow decrease in the number of new cases. We're seeing hospitalizations slow down in most of the state, for the most part, fairly stable here in Dane County. So in general, good news. We're doing pretty well here in Wisconsin. Vaccine rollout continues. We've got those variants that, could give us a little bit of trouble, but things don't look so bad right now today here in Wisconsin.
How do you account for the declining numbers?
You know, it's hard to say. It's probably multifactorial. I think part of it is when we got hit so hard with the disease back in late November, I think people get a more firsthand experience with the disease. Either they themselves had it or they know someone who had it. And I think that starts to change decision-making around what people are willing to do as far as take on risk related to COVID. And that's probably a big part of it.
Can you talk about Johnson & Johnson's vaccine?
Yeah, I think this is important. So, when I first heard the information, you hear something like, the vaccine is effective, 60%, 70% effective. And you start to think to yourself, you know what, like, why would I get that one when there's Moderna and Pfizer at 95% effective? And I think, we have to look at that ultimate metric, which is, when we get a vaccine, what is it that we're trying to prevent? It's really preventing severe sickness that lands me in the hospital or ends up killing me. And we look at all three of these vaccines, they all do a really good job at that. If you get these vaccines, you're likely not to get sick enough to go to the hospital. You're probably not going to die. And I think most of us, if given the choice between, say, a Johnson & Johnson vaccine that might be available 3 or 4 months before I can get a Pfizer or Moderna vaccine, would take, a slightly increased chance of having some mild symptoms, but protect yourself from getting really sick or dying, which would be a risk you'd take if you're unvaccinated at all.
Could you get the Johnson & Johnson and then when the other one's available, get that one?
Yeah, that would probably be a scenario, especially later on. I think what we'll see with some of these mRNA vaccines is they'll be tweaked to better match against these variants or other strains of the virus that we see, just because it's fairly easy to change those vaccines. So that would probably be a doable thing.
Are there any other vaccines that are, coming down the pipeline here that can also, just boost up the supply?
Yeah, there's also the AstraZeneca one that's still out there. It's approved for use in the United Kingdom and in India, not yet approved here in the United States. They haven't submitted that emergency use authorization. There's also a vaccine out there, Novavax, which is getting approval in some other parts of the world. So there are a few out there that are still waiting to be approved. And anything that increases our supply of vaccine is a really good thing right now, because that does seem to be the bottleneck or the pinch point for us getting vaccinated quickly is going to be vaccine that's available for health systems and other vaccinators to inject.
Do you think this is going to be like a yearly thing, sort of like a flu shot? You get a COVID shot every year?
Hard to know. I think two things we need to understand. One, how long does immunity last when you get vaccinated? For the most part, these studies are ongoing. We'll have the answer to that. And then the other thing that'll play into that is, how many different strains or mutations do we see? If we start to see mutations that defeat vaccines, we'll need booster vaccines that account for that. So I think it's possible, but just hard to say right now whether that'll be what happens in the future.
How has morale been over at UW Health now that, you've got a year under your belt? Your staff, your frontline workers have been vaccinated or are getting vaccinated. You guys have just been, burning the midnight oil forever. How is everybody feeling now?
Yeah, I think we're in a better place. Volumes are still really high, not necessarily COVID volumes. Those have piped down, but other patients are certainly seeking care and the hospitals are very full. But, there's just peace of mind that comes with being vaccinated, knowing that you have some protection against this disease where, we've seen just how awful it can be to people. And with COVID volumes being a little bit lower, that gives folks some breathing room. There isn't this anxiety about what to do with that next patient that comes in with COVID. So much better position right now than we were, say, into November, where things were really dicey.
We can't take the pedal off foot off the gas pedal as of yet, though. We're not out of the woods.
Right. I think that's an important message. One thing we worried about is with all this good news, it gets easy to think that this pandemic is over and we all want to get back to, 2019 life, but not yet. We still have a lot of vaccine that has to get out there. There's still COVID in our communities. People are getting sick. So reasonable to think about what life might look like in the next few months, but not able to do it yet. We still need to stay masked. We should distance, avoid those large and somewhat small gatherings for just a little bit longer.
Absolutely. Doctor, good to see you again. We'll talk to you next week.
You bet.
We'll have a final check your forecast coming up.